This video is about nursing, but the book we are going to use is this book. Now, we do not absolutely know Eugene's way of learning, but she has studied nursing and is an RN. Her clinical studies were not so good, and she didn't feel good enough to practice in an actual setting, but she was qualified to actually work as a living, tending, and caring nurse. We have two intimate ways of learning about nursing, no, not nursing, about doctors. We learn about the medical stuff, and we learn about how to care for patients. And this is the way we teach you how to care for yourself. You may not be a full nurse, but you'll have some basic knowledge that might make you better qualified to learn and practice healthcare on your family and other people. First, we want to learn about children. And the first thing I see on this book, because I'm learning as well, and we might ask Eugene some questions which she might not have an answer for because she was not the best student, but she was able to pass the exam. Now, I'm going to go to urgent assessment, and I'm going to read it. Children in physiological distress compensate with increased respiratory and heart rates. Physiological distress usually results from a respiratory disorder or significant blood loss. Even children with a known congenital heart problem rarely present in acute distress from ischemic heart disease. The additional work of breathing is evidenced in a distressed child by nasal flaring accompanied by retractions or abdominal breathing. Now we're going to stop there and let Eugene explain to us what this means. Physiological, the word physiological means, from my understanding, physical, like the functions of the body. Functions of the physical body, not emotional functions, but physical functions of the physical body. Now, it says physiological distress, so functional distress compensate with increased respiratory and heart rate. So your breathing gets faster and your heart beats faster. So when children, when they're physically stressed, their breathing becomes faster and their heart beats faster. So you can count a person's breathing, how many breaths a child takes in a minute. Usually it's about, I think for children it's a little higher, but it may be the same, I'm not sure about that. But for an adult, the regular breathing is about from 12 to 18 per minute. 16 is usually the norm. So you can base yourself on that. And heart rate is from 60 to about 80 or 90, about 80 I think. So no, it might maybe 90 or even up to 100. But if it's like 120, that's fast. A child heart beats faster, so maybe a little higher than that. But for an adult, it's from 60 to 100 probably is what a heart rate is supposed to be. So a children can be a little faster, but if it gets to 120, I say you check. You go to the hospital. Physiological distress usually results from a respiratory disorder, so there's something, a problem with the lungs, or significant blood loss. So there has been a lot of, the child lost a lot of blood, and so to compensate, so this is what happens when you lose blood. Now the blood contains hemoglobin, red blood cells. Okay, so blood contains red blood cells that carries the oxygen all over your body. But when there is a blood loss, the oxygen is diminished. The oxygen that is carried by the blood is diminished, and the body wants oxygen, and so it starts breathing faster. So the oxygen comes from the nose into lungs, right? So it breathes faster to get more oxygen. So blood loss, that's the connection with the blood loss. And so even children with a known congenital, congenital means from birth, a heart defect from birth, primarily present in acute distress from ischemic heart disease. Usually, so he's saying it's not a heart problem, but usually it's a respiratory problem. I'll just leave it at that. And the way you know this is a respiratory problem is that your nose is nasal flaring, means your nose goes like up, like widens and small contracts. So it goes like that, like that's nasal flaring, and accompanied by retractions. I'm not sure if I remember what retractions mean, but I think it's like maybe like heaving of the chest. It's like you heave, the chest heaves up and down. But you have to look that up. That's all I have to say. Teachers, that was a very good explanation. So we will say this much: we understand a lot more about it. So what kind of congenital heart defects can a child have? Usually, the heart has different chambers, right? So it has 4 chambers, and there are aorta, and there is the vena cava, like the tube, the blood vessel that goes from the heart to the body, and the blood vessel that comes from the body to the heart, and and there's also the blood vessel that goes to the lungs and comes back. There are holes in between these chambers. Like for example, there are holes between the vessels. Sometimes there's blood vessels, like there's holes there too, but usually like the chambers which has the atria and the ventricle, the heart, the chambers that receive the blood and the chambers that pumps out the blood. Now there might be a hole between, like there's like 4 chambers here. There might be a hole right here or a hole right here. There's a hole right here. But there when there are holes like somewhere like that, and or maybe up here when the vessels where the vena cava and the aorta, there is like a hole between that, or like between the lung vessels or something like that. So there are a hole between places where it's supposed to be divided, and so the oxygenated blood, so the blood that's full of oxygen, and the blood where there's no oxygen is like mixed when it's not supposed to mix, and so that causes a problem. Oh, I see why. There's usually it's that. I see. Okay. Thanks, Sujin. Now that's our first lesson. Okay, let's see what we learn more about the heart and lungs and other things. Thank you.